Okay, have a nice time with quality data analytics cases discussion.
So much, Doc. Good evening,
Yes,
Doc Gulam.
I like that cases discussion very much. I
Oh,
hope all
mashallah.
audience also will like it.
Yeah, Rab, inshallah. And I hope I can deliver it well and all of them will understand,
Yes,
inshallah.
yes, inshallah. Okay, you can start.
Bismillah ar-Rahman ar-Rahim. We will solve altogether the training questions for the matrix. The questions I have today are many, but they need to be many so that we can practice well on any question you might see anywhere on the data matrix questions. That will be with us in today's session to cover the curriculum well, especially this chapter. All right, so let's start. Bismillah ar-Rahman ar-Rahim. Number one, a small rural hospital wishes to evaluate customer satisfaction using a survey. The organization has 4 patient care units, an emergency department, and an ambulatory unit. Which of the following survey methods provides the most reliable information? A random sample of 20% of annual discharges per visits per unit. B, a random sample of 5% of all annual discharges or visits. C, all discharges per visits in January and July. And D, all discharges per visits of customers with a last name beginning with the letters A to E. What's the answer here? Hmm? Okay, so here now they want to conduct a survey here and they want to do sampling to represent the entire population. So, what is the best sampling method among these 4 options? Which is the best sampling method? Yalla, Doc Gulam? Hello? Radha? Hmm? Okay, in here, A and B are both good because in A and B we are selecting a random sample, and the random sample is always the best sampling method, which is probability sampling. So the random sample is, I've said, is very good. So the answer must be either or, must be either A or B. Now let's say A states that I will take 20%, okay, from each unit, meaning I have a large sample size, right? So this is a large sample size. So I am taking 20% from each unit. But in B, only how much? Only 5% at the level of the whole organization is taken. So in B, there is a small sample size. So which is better, A or B? Should I take a large sample size or a small sample size? Hmm? Who can answer? Okay, a large sample size, right? So A is better than B. Tamam? So when I take all the discharge patients from the months of January and July, what is this called? It is a type of probability sampling. But what is the name? This is what you call the convenience sampling. This is a convenience sampling. Okay? Clear? So let's proceed to number 2. Joe Smith wants to study patient satisfaction in his institution, but wants to get the largest group possible, so he conducts his study in the local mall. His study might be criticized not only for reaching individuals who are not patients, but also that it is A, capitated, B, non-randomized, C, randomized, D, varied. Anyone who has the answer? Okay. This is a very important question and is frequently repeated in exam questions. A researcher here wants to study patients of a health institution but wants to get the largest group possible. So he conducted the study in the local mall. So the study he conducted in a mall, will it be criticized not only because he surveyed individuals who are not actually patients, but also because it is what? Is it biased, non-randomized, or randomized? Okay, the study conducted in a specific mall, meaning in a specific area. Is this study randomized or non-randomized? Anyone can answer? Hmm? Okay, this is a non-randomized. So the answer here is letter B. Number 3, Walter Schwartz's causes of variation led him to develop methodology to chart the process and quickly determine when a process is out of control. This ongoing measurement and analysis is known as A, SPC, Statistical Process Control, B, RCA, C, FEMIA, D, TQM. What's the answer here? Okay. A researcher noticed that the worst cause of variation, which led him to develop a methodology to chart the process and quickly determine when the process is out of control. So this sampling, measurement, and analysis is known as, okay, so he is using a control chart. So that is, he is creating a control chart that allows him to determine whether the process is out of control or under control. So what do we call this measurement and analysis? Any answer? What's the answer here? So what do we call this measurement and analysis? It is the SPC, or the statistical process control. Okay, it helps us whether the process is under control or out of control. Okay, number 4, when incorporating the lean thinking into process improvement, the quality professional teaches the team to A, identify suppliers and their inputs, B, focus on special cost variation, C, consider the system's structure, D, identify and eliminate wasteful steps. Okay, when incorporating the lean thinking, okay, into process improvement, the quality professional teaches the team to, okay, when for example, I provide an education or training as a quality professional, what do I teach? What do I teach? Okay, the answer here is identify and eliminate wasteful steps. Because in lean, what do we focus on? What is the main concept in lean? Is to what? To remove waste. Okay, so we focus on waste causes. Clear? Okay, let's move on to number 5. Statistical process control is important first to A, eliminate assignable causes of variation, which is special cause. B, eliminate random causes of variation. C, prioritize causes of variation. And D, eliminate all causes of variation. Okay, any answer here? Doc Gulam? What is your answer here, Doc Gulam? Any answer? Okay, the correct answer here is letter A, eliminate assignable causes of variation. To say that the process is under statistical control, what must I do? So to eliminate assignable causes of variation. But why didn't we choose, for example, letter D, eliminating all causes of variation? Because we said that common causes cannot be eliminated. We reduce them and improve them. We don't eliminate them, but elimination is for special causes, not common causes. Okay? Next, number 6. When common cause process variation is identified, the goal of quality improvement is to A, promote compliance with established procedure or protocol, B, eliminate the variation, C, improve practitioner competency, D, reduce variation sufficiently to produce stability. In here, when common causes are identified, I found that I have a common causes. So what is my goal here? The role,
Annabella, please
yes, the,
mute all, please. Mute all.
mm,
Okay, share screen and open your mic.
Doc. I will start recording, Doc.
No, recording
Oh,
already.
okay,
Already.
tamam. Okay, Doc. Okay, again, number 6. When common cause process variation is identified, the goal of quality improvement is to A, promote compliance with established procedure or protocol, B, eliminate the variation, C, improve practitioner competency, and D, reduce variation sufficiently to produce stability. Okay, in here, when common causes are identified, I found that I have common causes. So, what is my goal? The role of the common causes in quality improvement is to, okay, we have to promote the compliance with established procedures or protocols. Also, we have to standardize the improvement and the reduce variation. And next is to reduce the deviation. So, in here, he is talking about the common causes. Okay, the common causes. What do we do with these common causes? Okay, what do we do to reduce variation sufficiently to produce stability? Okay, so number 7, special cause variation is to the process. Letter A, random, extrinsic outlier. B, assignable, intrinsic, noise. C, random, inlier, and identifiable. D, assignable, extrinsic, and outlier. Okay, what's the answer here? Which row contains all the correct definitions for special causes? Hmm? Any answer, Dok Gulam or Radha? Okay, the correct answer here is here, assignable, extrinsic, outlier. As for random, that belongs to, this is common cause. What about the intrinsic? This is also common cause. Okay, for the noise, this is also common cause. What about the outlier? It's also a common cause. Identifier and identifiable is also a common cause. So these are all names for common causes. That is why in the slides that I provided the definitions for special causes and common causes so that we do not get questions like this wrongly. Okay, so everyone, there any question regarding number 7 question? Okay, so let's proceed. Number 8. Applying the Pareto principle in quality improvement is A, prioritizing process issues, B, tracking and measuring process effectiveness, C, providing meaningful data to support strategic objectives, and D, prioritizing patient outcome issues. Okay, in applying the Pareto principle in quality improvement means what? Any answer here? Dok Gulam? Radha? Okay, so the answer here is prioritizing the process issues. What do we use prioritization for? Prioritization for what? Okay, to apply prioritization. So where is prioritization applied then? So it is in letter D. Okay, prioritizing the patient outcome issues. But which answer is better and more comprehensive? Should we prioritize process issues or patient outcome issues? Because when we say patient outcome issues, when we look behind them to solve them, what do they relate to? They relate to processes, okay? So the best answer here is prioritizing process issues is the best choice. Okay, number 9. Common causes of problems in a process refer to what? A, one-time situations, B, temporary situations, C, acute situations, D, chronic situations. Okay, which of the following would be considered an example? Okay, common causes of problems in the process refer to what? Okay, it is a chronic situations. Common causes are considered chronic situations. Okay, number 10. Which of the following may be considered examples of discrete variables? A, height and weight, B, community acquired and nosocomial infection rates, C, surgical or emergency department response time, D, patient visits in the months of May and June. Discrete data is a non-continuous data. Okay. So this is a non-continuous data. So what's the answer here? Okay, letter D. Patient visits in the months of May and June. Non-continuous data is a qualitative data. Okay, so let's analyze them one by one. For the height and weight, do they allow decimal values? Yes, they allow, and they are continuous data. Tamam? What about the community acquired and nosocomial infection rates? Does it allow decimal values? So we divide the numerator by the denominator, like infection rate or mortality rate. Since it is a specified type, it can have a decimal values. So it is a continuous data. What about for the surgical or emergency department response time? Does time allow decimal values? Yes. Okay. It's a continuous data also. So patient visits in May and June. Can we say a patient visited 1.5 times? No, of course. It must be a whole number. So this is not a rate. It is an exact count. So it is a discrete data. Any questions so far? Okay, let's move on. Number 11, the method of ordering data by listing all possible values and all individuals receiving each value is called A, the range, B, the standard deviation, C, a simple frequency distribution, D, a grouped frequency distribution. Mhm. So a method for arranging data is what we call listing. So we create a listing. Okay, so I make a listing of all possible values and count how many times they occur. So for example, if we are talking about grades, I list how many students got excellent, how many got good, how many got very good. So what do we call this? Any answer? So this is a simple frequency distribution because there was no mention of a wide range of values. If we had a wide range, we would use a grouped frequency distribution. Since it was not mentioned, therefore it is a simple frequency distribution. Number 12, what percentage of total number of units typed and cross-matched for January was wasted? Letter A, 6.5%, B, 5.5%, C, 21%, and D, 4.5%. Okay, now I will solve this question using the table provided. We have a table in the exam and we will interpret it. The table is about plasma utilization samples for the first quarter from January to March. So the total units infused or the units actually used. Okay, so we have here total units infused in January 360. Okay, the wasted units, we have 21 for January, 13 in February, and March 38. The wasted units are those that are not used. So we have also wasted units here. And now we calculate. So in January, for the total cross-match units, how much in January? We have here 381. Wasted units, how much? So we have 21. So how do we calculate the percentage? So we divide the wasted units by total cross-match units. So we have 21, okay, divided by 381 times 100%. So what's the answer here? It is 5.5%. So letter B is the correct answer. Okay. Number 13, what percentage of cross-match units were infused in March? So looking at March, so letter A, we have 91%, B, 89%, C, 99%, and D, 92%. Looking at March here, so total units cross-match was 422. Infused units was 384. And wasted units, we have 38. So we divide the infused units by total cross-match units. So we have here 384 divided by 422 times 100%. So what is the result? It gives us 91%. Letter A is the correct answer. Number 14, what percentage of total infused units in March were whole blood? Total infused units in March here is 384. Whole blood units is how much? We have the 15, okay? And where are we? Okay, 15. So we divide the whole blood units by the total infused units. So we have here 15 divided by 384 times 100%. That give us, okay, how much? 4%. That gives us letter C is the correct answer. For number 15, what is the ratio of units wasted to total units typed and cross-match in February? Okay, in February, pay attention. Ratio means keeping the numbers as they are. So not converting to percentages. So here in February, the wasted units we have here is 13. What about for the total cross-match units? We have, okay, total cross-match units, we have 300. So the ratio is 13 is to 300. So letter B here is the correct answer. Number 16, based on accuracy review of the data, which aspect of blood utilization would you recommend first for further investigation? A, typing and cross-matching. B, units wasted. C, single unit transfusions. D, use of whole blood. Any answer? So which of this requires investigation because there's a problem or an issue? Of course, the units that were wasted. So I want to see why the waste occurred so that I can minimize it as much as possible. Yes, wasted units. Okay, so the answer here is letter B. Okay, clear? Let's move on. Number 17, when data has a range of values between the lowest and highest that is wide, but you want to rank order them, it is best to use A, line graph, B, simple frequency distribution, C, grouped frequency distribution, and D, cumulative frequency distribution. Okay. Since he mentioned here a wide range of data, so what should we use? Yes, it is the group frequency distribution. Okay, number 18, the average between the highest and lowest measures is the A, median, B, mean, C, mode, D, dispersion. Okay, the answer here is letter B, which is the mean, meaning the average. What does it refer to? The average is the mean. Okay, average is equals to mean. Number 19, what is the total big N? Number A, letter A, 11, B, 8, C, 19, D, 15. Okay, in here, I have a table and I need to analyze it. So the table is showing the total N, okay, which is the population. This is the population count. So how many values do I have? Okay, so 1, 2, 3, 4, 5. Okay, so across these three groups. So what is N here? So 5 times 1, 2, and 3. So that gives us 5 times 3 is equals 15, which is your population count. Okay, number 20. What is the range of values? A, 11, B, 8, C, 19, D, 15. What's the answer? So how do we calculate the range? So range is equals to from highest value minus the lowest value. So what is the highest value here? So 19, right? Minus 4. Okay, so that gives us 15 is the answer, letter D. So that's how you get the range. Okay, number 21. What is the arithmetic mean? A, 11, B, 10, C, 9, D, 8. Okay, so how do we calculate the mean? So it is the sum of values divided by the total count. So let's add all of these numbers. Okay, so this will give us 150 divided by 15. So this gives us the mean answer of, okay, 10. So letter B is the correct answer. Okay, what is the mode here? Letter A, 11, B, 10, C, 9, D, 8. Okay, mode is the most frequently occurring value. So which number appears the most time? Okay, when we count 5, how many times it appears? It appears 2 times. What about number 8? Okay, 1, 2, 3. 3 times. Okay, what about 12? Appears how many times? 12, 1, 2. Okay, 2 times. So what is the mode we have here? Okay, number 8 is 3 times appeared in our table. So letter D is the correct answer. Okay, number 20. Where are we now? 23, I'm sorry. Okay, number 22. What is the median? A11, B10, C9, D8. So how do we calculate the median? So the middle value after sorting the data. So first, we have to sort all the data. So is the data already sorted? Yes. So it is already sorted here in our table. So now, once sorted, then apply the formula of n plus 1 divided by 2. So what's the answer here? Where n is our population count plus 1. Okay, plus that this will give us how much? 16 over 2. This gives us the answer of 8. So Letter D is the correct answer. Okay. Number 23, the most accurate measure describing the amount of variability in a distribution is the A, variance, B, range, C, standard deviation, D, dispersion. What's the answer here? Okay. The answer here is the standard deviation is the most accurate measure of variability in distribution. Okay. Number 24, the rate of increase or decrease in total medication errors over a 6-month period could best be best be displayed by the use of a excuse me, A, frequency polygon, B, line graph, C, bar graph, D, cumulative frequency curve. Here we need to determine the what type of data it is. Is it continuous or non-continuous? So how should we apply it? First is to know the rate. Is it continuous or non-continuous data? Because rate is a continuous data. Okay. So once I know it is a continuous data, then I have 3 options. So we have histogram, okay? We have the control chart, tama? And the run chart. Okay, these 3 are options or a continuous data. Now he is asking for data over time. So which one is best for data over time? What's the answer? It's letter B, or the line graph. Okay. So histogram is not suitable for overtime data. The answer here is line graph. Okay, number 25. Measurement and assessment activities by the local ambulatory surgery center indicate that monthly surgical site postoperative infection rates have increased over the past year. A comparison of the local center's aggregated rate to the other surgery centers in the same region for like procedures is best displayed by the use of A, bar graph, B, pie graph, C, grouped frequency distribution, D, line graph. What's the answer? Okay, the statement here is a local employer measured a monthly surgical site infection rates, so which showed an increase over the past year. How should this be displayed? So since it is a monthly data, meaning over time, so we use a run chart or control chart. Okay, so in here we have letter. What's the answer here? The correct answer here is the line graph. Number 20. Okay, hold on. 25. Okay, number 26. Number 26, you are setting up the data collection methodology for study of certain inpatient cardiac procedures. So of the following, where might you look for the most concise basic information? B, master patient index, B, disease index, C, surgical index, D, surgical log. Okay, you are setting up the data collection methodology for a study of certain outpatient cardiac procedures. So where would you look for the most consistent basic information? So you want to collect data on outpatient cardiac procedures. So where would you collect this data from? From where? Okay, the correct answer here is letter C, from the surgical index, because this contains the records of all surgeries performed, and it is a register of surgical procedures. What about for letter A? This is the index or register that contains the names of all patients admitted to the hospital. For disease index contains the records of different diseases that patients were admitted. For example, diabetic patients, hypertensive patients, or hyperlipidemia cases. Okay, so now where would you look for the outpatient cardiac procedures? Would it fall under disease or surgeries? Okay, since it is a procedure, so it falls under surgeries, not disease. So now, should you go to surgical index or the surgical log? What is the difference between an index and a log, by the way? When we say index, this contains the names of all procedures performed, while the log is like a journal that provides a detailed information about each surgery. So surgical index contains the names of surgeries performed, which is the best answer or correct answer in the question given. Okay, number 27. Your medical center quality management department is asked to prepare quarterly summaries comparing cause of death as listed in the medical record with final autopsy findings. How could you set up the initial screening process to minimize effort? Okay, letter A, use the master patient index. B, use the death register. C, contact the pathologist on a regularly scheduled basis, and the re-review all death charts after 90 days. In the quality community, they ask you to prepare a summary comparing the causes of death as listed in medical records and the final autopsy findings. So where would you look for these autopsy results? Okay, it's the use the death register because these are the records of deaths. So where do autopsy result appear also? Okay, it is in the death register. Okay, so since they're discussing the final autopsy findings, they are referring to causes of deaths. So you should check the death register. So letter B is the correct answer. For number 28, management information systems are designed to be A, separate data sources, B, primarily manual, C, used in decision making, D, used primarily for long-term data storage. Any answer here? Why do we use management information system, by the way? This is to store data sources and also to serve as primary manual records. And this also to serve as primary long-term data storage. Okay, and to assist in decision making. So what is the purpose of information management? What's the answer here? It's letter C, used in decision making. Information management means data analysis. So why do we convert data into information? Because this to assist in decision making. So letter C is the correct answer. Number 29, in selecting software for quality improvement activities, it is essential to A, involve all potential users in determining specifications. B, have information systems that staff make the final decision. C, have administration make the final decision. D, trust potential vendors to draft specifications. Integrating the software for quality improvement activities is essential for what? This is to involving all the potential users in determining specifications. So this is the correct answer. Okay, so if we are implementing the electronic medical record software, what do we need to do? So we need to conduct a focus groups, okay, or meeting with the end users. Okay, so who are the end users, by the way? So these are doctors, the nurses, or anyone using the system because they will provide the requirements they need for the system to function properly. The best answer is involving all the potential users in determining specifications. Okay, number 30. A focus review of every other case seen in the emergency department on June 2 is an example of which type of sampling? Letter A, non-probability quota. B, stratified random. C, systematic random. D, non-probability purposive. What's the answer? Okay. So if I say every other case is the keywords here. So this means choosing the first case, then you have to skip one. Choosing the third case, then you have to skip one. Then choosing the fifth case, skipping the other one. So what you call this kind of random sampling? It's called systematic random sampling. Okay, number 31, in order to have the most direct access to data regarding patients in your organization, along with analysis and report capability, your computer system must be at least a personal computer with a network link and your own database software. B, a terminal networked to the mainframe. C, a personal computer with statistical graphic and report generating software. And D, a notebook computer that can go where you go. Okay, what type of computer here? Computer system should be used. A hospital computer system used by doctors in clinic should be. Okay, so now, does every doctor in their clinic have a personal device that can generate statistical reports? Of course, no, because only the administration handles this statistical reporting and analysis. So what do doctors have? The doctors have a what? A personal computer with a network link and your own database software, which allows the administration to collect data from all devices and generate reports. Okay, clear? Number 32. According to epidemiological theory, the rate of new cases of transfusion reaction since the previous year would be termed a numerator, B, a denominator, C, a prevalence rate, and D, an incidence rate. So according to epidemiological series, the rate of new infection cases in the previous year is called is called new cases. Okay. So new cases means equals to incidence rate. Okay, meanwhile, old plus new cases, that is old plus new cases, is called the prevalence rate. So what's the answer here? The answer here is incidence rate. Okay, the rate of new cases is equals to incidence rate, and letter D is the correct answer. Number 33, when comparing average immunization data from two pediatric medical groups, it is appropriate to use A, standard deviation, B, a t-test, C, a chi-square test, and D, variance. So average means what? It refers to the mean. Tamam? So mean is a continuous data. So what test is used for continuous data comparison? Standard deviation, t-test, chi-square, or variance? Okay, what's the answer here? It's yes, a t-test is used for continuous data comparison. So meanwhile, chi-square is for non-continuous data. Number 34, the use of regression analysis to help determine relationships between groups of numbers is most closely associated with which graphic display technique? A, frequency distribution; B, scatter diagram or relationship; C, line graph or comparison over time; D, histogram, the continuous data display. If I want to determine the relationship between between variables, so which graph should I use? Which one determines relationship? Which one? It is the scatter diagram, because this help visualize the weak relationship, the moderate relationship, and the no relationship at all. So scattergram is the correct answer. Number 35, the ability of a data measurement tool to produce the same results over a period of time is known as A, sensitivity; B, specificity; C, validity; D, reliability. If a tool produces the same result repeatedly, this is called reliability. Okay, that's the correct answer. Produces the same results over a period of time means reliability. Number 36, you are the quality professional for a large provider organization. You have two sets of monthly utilization data: the total cost and total reimbursements from payers for the last 2 years. To best display the data for the full 2 years, which of the following types of graphic displays should you use? A, pie charts; B, bar charts; C, run charts; D, Pareto charts. What's the answer? So let's analyze this question carefully. It says that you have two sets, of data, right? So in here, this data sets are referred to the monthly utilization. So since it is a monthly utilization data, so which I will write on the X, okay, X axis. I will write the months from January, okay, to December. So covering the last 2 years, January 2022, December, January 2020 to 2022 for 2 years. So the data are spread over 2 years and the values represents the monthly utilization. So since the data are continuous, which type of chart should be used in here? So when we say continuous data, I mentioned before, continuous data, we have the histogram, the run chart, and the control chart. Now, what am I displaying? Displaying of the total cost and total reimbursement over the 2 years. So to check whether reimbursement match costs or if there is a gap. So what is the best type of graph to be used here? Okay, it is the run chart. Okay, the two sets of data over the full 2 years, we will use the run chart. If the reimbursement data is broken out by payer for the last year, which statistical calculations and chart would probably be more informative? A, pie charts and means; B, bar chart and means; C, run chart and standard deviations; D, Pareto chart and percentages. Okay, what's the answer? Which statistical conclusion chart would be most appropriate? Now, I am not looking at trends over time, but rather comparing the total cost with the total reimbursement. So what will I write on the x-axis? I will write the total cost and total reimbursement instead of months. So I'm comparing these two categories. So if I need to see if they match or differ. So for example, total cost is $1 million. So the reimbursement is $800,000. So what's the difference? It is $200,000. So I need to compare them visually. So which graph is best for comparing these two groups? is, what's the answer here? Is letter B, bar chart and means. Okay, since this is a comparison rather than prioritization, so we do not use this Pareto chart, but instead we choose the bar chart and the means. For 37, which is the best graphic display to show proportion? A, pie chart, B, bar chart, C, run chart, D, Pareto chart. Proportion means part of a whole. Okay, proportion is part of a whole. Okay. So part, and it is part of the whole, which is the pie chart is the correct answer. Number 38, which display is best to help the ambulatory clinic team decide which of 10 reasons for patient dissatisfaction to address this year? A, pie chart, B, bar chart, C, run chart, D, Pareto chart. Okay, they want to prioritize the most important issue. So meaning prioritization. When we say prioritization, it is the Pareto chart. Okay, 39. The primary care clinic tracks callers' telephones wait times as a recurring performance measure twice a year. In the last 2 months, wait times have been increasing. On the latest run chart, 8 consecutive data points, all in ascending order, with 21 total data points represents A, common cause variation, B, special cause variation, C, cyclical variation, D, astronomical value. So they have been tracking the waiting time here, the waiting time for 2 months, and the waiting time is increasing. So since waiting time is a continuous waiting time is continuous data, it should be displayed on run chart or the control chart. Now they mention the 8 consecutive data points in ascending. Okay? For example, okay, here. Okay. In ascending order, so what does this indicate? What does this means? So this is a trend. What type of variation is it? Is it a common cause? Is it a special cause, a cyclical or astronomical value? It is a special cause variation. A trend is a special cause variation. Number 40. As quality management director at Sunshine Community Medical Center, you are conducting comparative analysis of the surgical wound infection rate data between 2 surgical units. The p-value of the chi-square test you run will help you draw what conclusion about the relationship between the 2 sets of data. A, ratio of the 2 rates. B, standard deviation of the difference from the mean. C, proportion of the relationship. D, significance of the relationship. So the p-value is the statistical, means the statistical significance. When we say that if the p-value is less than 0.05, what does this mean? So the difference is statistically significant. Statistically significant. Okay. What about if more than the p-value is more than 0.05? What does this mean? Okay, the difference is not significant. Okay, so the answer here is the significance of the relationship. That's the answer. Number 41. Your medical group has recently merged with 2 other medical groups and 3 hospitals covering 20,000 square miles. You have been asked to participate on a team to purchase software to link as many clinical activities as possible for coordination of care, integrated billing, and performance and outcome measurement. What is the most important requirement you must specify? A, ability to integrate separate existing databases in real time. B, standalone PCs to assure confidentiality and security. C, a completely automated patient record to get all the data. And D, ad hoc reporting at all levels in each organization. Key purpose of software, by the way, is for data integration. So what is the main important factor of the software is the data integration. So the answer here is letter A, ability to integrate separate existing databases in real time. Number 42, the Pareto rule is which of the following? Okay, A, 80% of quality management activities are wasted. B, 80% of the problems have 20% of the impact. C, 20% of the problems have 80% of the impact. D, 20% of the cost reap 80% of the benefits. When we say 80% of the quality management activities are wasted, it means 80% of activity comes from 20% of resources. Okay, for letter C, this means that 20% of causes have 80% of the effects. Okay, for letter D, 20% of causes have 80% of the effects. So what's the answer here? Because when we say Pareto rule means 20% of causes contribute to 80% of the effects. So the answer is letter C. 20% of the problems have 80% of the impact, which means 20% of causes contribute to 80% of effects. That's the Pareto rule. Number 43, in the community health clinic, at least 4 complaints have been received per month, meaning 1 complaint in every month for the past 4 months, compared to an average of 1 per month for the 6 prior months. The average number of patients seen per month is 2,000. The trigger is more than 0.2%. What is the appropriate response? A, select a more useful indicator. B, perform intensive analysis now. C, trend for at least 3 more months. D, reward. Reward the entire staff. So in the statement previously, 4 complaints per month for 4 months. So now 1 complaint per 6 months. So this indicates a problem. So complaints are increasing. So what should be done? Okay. So is this a common cost variation or a special cost variation? Because it is used to be a 1 complaint per month, which is the common cost. And what about for increase to 4 per month? Is it common cost or special cost? Okay, it is a special cost. So what do we do for this special cost variation? So we will do B, perform an intensive analysis now. Okay. Number 44. Sometimes when developing indicators to measure performance, a specific criteria must be written to fully define the measure. This type of criteria facilitates which step? A, intensive analysis. B, initial analysis. C, data aggregation. D, data collection. So before you collect any data, you must define the criteria first related to that data to ensure a good data collection. What step does this belong to? So before the data collection, I must define the criteria. Okay, criteria for the data. What does this step help with? Okay, in data collection. Since I am defining the criteria before collecting the data, this step falls under collection. Okay, number 45. Brainstorming is best used to A, identify or refine cause and effect relationships, B, perform intensive analysis or peer review, C, subdivide or organize a large number of ideas, C, identify, analyze, or plan solutions to problems. Okay, so which tool is used to identify these cause and effect relationships? So we call this cause and effect relationship. We use the fishbone, okay, or the Ishikawa diagram. So which tool is used to organize a large number of ideas? Large number of ideas is what we call this tool is affinity diagram. Okay, brainstorming is used to identify and plan solutions to problems. So that gives letter D. The correct answer for brainstorming is best used to identify, analyze, or plan solutions to problems. Okay, number 46. An affinity diagram is best used when A, information is clearly connected to one issue. B, there is an inadequate information. C, the volume of information is very large. And D, brainstorming is not an option. Okay, I have mentioned already affinity diagrams help organize large volumes of information. So that gives letter C is the correct answer. 47. Of the following, which quality improvement tool best demonstrates cost and effect? A, fishbone diagram, B, flow chart, C, Pareto chart, D, affinity diagram. Okay, letter A is the correct answer. This is used to analyze causes and their impact on the process, the fishbone diagram. Number 48. It is generally understood that the patient owns the information in his or her medical record. The physical record is the property of the A, patient, B, physician, C, healthcare organization, C, third-party payer. Okay, who owns? Who owns? It's the healthcare organization. Okay, the patient owns the information, but the healthcare organization owns the physical medical records. Number 49. The QI team is responsible for determining whether the data demonstrates special or common cost variation. Of the following, what is the best display option to use? A, run chart, B, Pareto chart, C, scatter diagram, D, control chart. What's the answer? Sorry. Okay, the correct answer here is the control chart, because both common and special causes can be best displayed to control in a control chart. Okay, letter D is the correct answer. Number 50, the number of designated women receiving breast cancer screening or mammograms in the reporting year measures A, process, B, clinical outcome, C, process outcome, D, process and clinical outcome. So if I'm measuring screening or this investigation, so it is what we call process. So if I were measuring the treatment results, it will become a clinical outcome. So what's the answer here? The answer is process outcome. Okay. Number 51. Confidentiality of information is best accomplished by A, limiting access, B, obtaining proper consent to release, C, having all staff sign a confidentiality agreement, D, removing all patient and practitioner identifiers from documents. What's the answer here? So meaning if I limit access, unauthorized staff cannot view patient data. Even if they sign a confidentiality agreement, they might still access the data. So the answer is letter A, limiting access. For 52, the part of documentation for medical staff, peer review, what is most often missing is A, findings and conclusion, B, recommendations, C, actions taken, D, follow up, evaluation of action effectiveness. The most commonly missing step is the follow up. Okay, follow up or the evaluation of action effectiveness. Number 53, the most important time to collect and use data is A, before the quality improvement project begins to prove a problem exists. B, during the quality project to answer questions about cost. C, during the quality improvement project to help prioritize the implementation of improvements. D, after the implementation of the improvement to maintain the gain. What's the answer? The most important time is what? Before the project starts or begins. Because to identify the problems, to define causes, and to set improvement plans. So before the quality project begins, to prove a problem exists is the correct answer. Number 54, inpatient length of stay or the LOS is the number of days, including the day of admission and excluding the day of discharge. What data elements are essential in order to calculate the average length of stay for simple pneumonia patients for first quarter this year? A, number of discharges and number of patient days. B, each pneumonia patient's length of stay. C, number of pneumonia patients and number of discharges. D, total length of stay for pneumonia patients. Okay, what's the answer? To calculate the average length of stay of LOS. So we have the formula. Length of stay is equals to date of discharge minus date of admission. What about for the average length of stay? Is equals to length of stay over total number of discharges. So to calculate an average, I need the total length of stay for all patients and the total number of patients. So the answer here in number 54 is letter B, each pneumonia patient's length of stay, because this is the date of discharge minus the date of admission. Okay, let's move on to number 55, a performance measure that records the number of well child visits within the first 15 months of life in the reporting year is a measure of A, structure, B, process, C, outcome, D, process and outcome. What's the answer here? Okay, it is letter B, process. Okay, number 56, providing the patient or representative with enough information to permit a knowledgeable decision regarding submission to an upcoming surgical procedure is the responsibility of the process described above is called a consent for treatment, B, informed consent, C, release of information, D, pre-authorization. So I am providing the sufficient information to the patient and their family about the procedure so they will understand any alternatives and any risk or side effects. So what is this process called? Okay, we called it as the informed consent, which is required before any invasive procedure. Number 57. When interpreting a run chart or control chart, a cyclical pattern of data points indicates that A, there is normal common cause variation, B, something systematic is affecting the process, C, there is a need to change the process, D, the process is in statistical control. So a cyclical pattern in a control chart would look like this. Okay. So for example, we have the UCL here, and then we have the LCL, and then we have here. Okay. So it looks like this, like that, and like this. Example. Okay. So just connect the dots. Okay. So there is a cyclical pattern. So is this normal? Okay. This kind of pattern, is this normal? No. So is this a common cause? No, of course. Is this in the statistical control also? No. So this indicates a systematic problem affecting the process. So meaning there is a special cause variation. Okay. So the answer here is letter B. Something systematic is affecting the process. Number 58. The performance indicator, total unscheduled inpatient admissions following ambulatory procedure within 48 hours, is a measure of A, structure, B, process, C, outcome, D, process and outcome. What's the answer? It is letter C. It is an outcome measure. Since this is measuring the total inpatient admissions, so it is an outcome measure. Number 59, a report card or a report that helps consumers evaluate the quality of care and services of health plans or providers. A is required to receive accreditation. B shows comparative performance in specific areas. C is based on the organization's unique performance measures. D aggregates data showing how quickly patients return to health. Okay, the answer here is letter B, shows comparative performance in specific areas. A report card is a consumer evaluation tool. It is used to compare performance in different healthcare areas. So B is the correct answer, that shows comparative performance in specific areas. Okay, number 60. The Quality Council has received a recommendation from a quality improvement team to completely redesign the appointment process, telephone system, and website to address the expectations of patients for timely, easy access to the integrated delivery system or the IDS clinical sites. Which of the following should the council validate before approving the project? A, the accuracy of the data. B, the team's analysis process. C, the team's interpretation of the analyzed data. D, the team's charter. Okay, what's the answer? The answer here is letter C, the team's interpretation of the analyzed data. Because the team's ability to correctly interpret the analyzed data as interpretation is the most critical part of the data analysis. Number 61, data collection is part of which performance improvement process? A, design, B, monitoring, C, analysis, D, improvement. Okay, data collection is done during B, monitoring, as it tracks performance after the implementation. Number 62, if planning data collection for antibiotic use in urinary tract infection or UTI, what should you do first? A, define UTI. B, define the population. C, determine which antibiotics to include. D, determine which sampling method to use. Okay, before collecting any data, the first step is to define the objective of the data collection. So letter A is the correct answer. You have to define the UTI first. Okay, number 63, comparison data is best displayed by a flow chart, cause and effect diagram, and scatter diagram. Letter B, run chart, table, and scatter diagram. C, pie chart, control chart, and Pareto chart. Letter D, flow chart, cause and effect diagram, and affinity diagram. What is the best display format for comparative data? Okay, when we say flow charts, this shows process relationship. Okay, so this is not a comparative. What about the cause and effect diagram? This shows relationship between the cause and effect. For the scattergram, this shows relationship. Used relationship between variables. So it is not comparative. For the run chart, used for tracking trends over time, not a comparative. Comparative data is best shown using, okay, we have the pie chart, control chart, and the Pareto chart. So this is the correct answer. Okay, number 64. What is number 64, relationships are best displayed by a flowchart, cause and effect diagram or scatter diagram. B, run chart, table, or scatter diagram. C, pie chart, prioritization matrix, or Pareto chart. D, flow chart, cause and effect diagram, or check sheet. Flow chart. So this is relationship. Okay, cause and effect. Cause and effect relationship. Scatter shows the strength of relationship. Okay, so the answer here is letter A. So this is flow chart, cause and effect diagram, or the scatter diagram. Okay, this is the best display for relationship data. Number 65, at the We Care Urgent Care Center, wait times from resignation to registration to physician contact are calculated and averaged daily. The data is tracked monthly using a run chart. Which of the following would indicate a true statistical increase in treatment delays? Letter A, 4 consecutive ascending data points. B, p-value of 0.0515. C, 8 consecutive ascending data points. And D, 7 consecutive descending data points. So what's the answer here? The answer here is letter C. Okay. Okay. In here, what tool is used to track patient satisfaction over time? So we have the flow chart. We have also the check sheet. We have the Pareto chart and the scatter diagram. So a check sheet, okay, is used for monitoring the and tracking the satisfaction trends. Okay. So this is the correct answer is letter C. A true statistical increase in treatment delays is with 8 consecutive ascending data points. For 66, a Sunshine Medical Center implemented a clinical pathway for CVA with the goal to transition from acute care to the next level of care after 5 days acute length of stay, or the LOS. Review the histogram below and use the information to answer questions. At an average care center, okay, so what would indicate a sustained increase in the treatment delay? Okay, in here, So since waiting times are increasing here, so the data point should be ascending. It's going up. So a trend in a chart is how many data points? So it is 5 or more consecutive points in the same direction. So the best answer here is, okay, that one, the eight consecutive ascending data points. So that's it. For the histogram, what's the answer here for 66? It's letter T. Length of stay is within the control limits. For for here, the histogram represents A, standard practice; B, standard deviation from the mean; C, cumulative frequency; D, a frequency distribution. Okay, what's the answer here? It is, okay, it is a frequency distribution. Number 67, of the following possibilities, what does the control chart below tell you? The CL equals to center line, either mean or median. Okay. So depending on type of data. So we have the lower control limit of 0. So letter A, we have choices. 3 sentinel events occurred since mid-2006 with effective intervention. B, special cause variation occurred with effective intervention in mid-2007. C, falls are within control limits since mid-2006. D, falls are out of control since mid-2007. The control chart interpretation. So the chart includes, we have the upper control limit and we have the lower control limit. So what is the center line? Central line here is the mean. So the chart shows points outside the control limits. So we have here the outside control limits indicating out of control variation. The main shift occurred in mid-2007. Okay, mid-2007. So we have here, June. So as you can see, okay, the chart shows points. There is an outside control limit indicating of out of control variation. The main shift occurred in mid-2007 with a sharp increase beyond the UCL. So the question here, what is the correct conclusion? So there were 3 consecutive, 1, 2, and 3 dependent points of care since mid-2007 affecting the control. And there is a shift in variation occurred in mid-2007 requiring an intervention. Then all patients have been out of control since mid-2007. Okay, everything is talking about in this figure. So option one is incorrect because only 2 consecutive points were out of control. So this is incorrect. What about letter C? Option number 3. This is also incorrect. Falls are within control limits since mid-2006 because not all patients were out of control. 2006. What about option number 4? This is also incorrect because only one major shift occurred, not a complete change. For option number 2, special cause variation occurred with effective intervention in mid-2007 because this requires intervention. So this is the correct answer, a shift in the variation that occurred in mid-2007. And this requires an intervention. Number 68, focus groups provide patient or customer input or feedback. What type of information do they offer? A, qualitative, B, quantitative, C, measured, C, opinionated. Focus group involves what? Involves discussion, opinions, and subject feedbacks, which are a qualitative data. Okay. So when we say data group interpretation, we compare the actual versus the target performance. And in the control charts, we have to identify the shifts and out of control points. When we say focus group, we have to collect qualitative data and not numbers. Okay, so study hard. That ends our health data analytics cases for tonight. Any questions so far? Okay, if none, so let's proceed to our quiz, final quiz number 5.